Alagille syndrome reveals a complex tapestry of symptoms influenced by genetic mutations. Recent research has uncovered that individuals diagnosed with Alagille syndrome exhibit a range of symptoms that can significantly differ based on whether the underlying genetic mutation is found in the JAG1 gene or the NOTCH2 gene. This insight comes from a comprehensive global study that sheds light on the nuances of this genetic condition. The findings indicate that patients with mutations in the NOTCH2 gene tend to experience fewer heart defects and show a lower prevalence of the syndrome's hallmark facial features and atypical vertebrae shapes. Interestingly, because NOTCH2 mutations are relatively rare, there has been less extensive research into the specific characteristics associated with these mutations. The researchers emphasized a critical point. Relying solely on the typical signs and symptoms may overlook cases of Alagille syndrome caused by NOTCH2 variants. This suggests that expanding genetic testing protocols could enhance the diagnostic process, ensuring that more individuals receive accurate diagnoses. In their study, the team not only identified variations in how the disease presents, known as phenotype, but also conducted a thorough analysis of several NOTCH2 mutations linked to Alagille syndrome. This included 18 mutations that had not been documented before, allowing the researchers to evaluate the likelihood of each mutation contributing to the development of Alagille syndrome. The research, titled Phenotypic Divergence of JAG1 and NOTCH2 Associated Alagille Syndrome Disease-Specific NOTCH2 Variant Classification Guidelines, was published in the journal Liver International. Symptoms of Alagille syndrome can affect multiple organs and systems. Alagille syndrome is a genetic disorder that can impact various organs and systems within the body. Common symptoms include liver dysfunction, heart irregularities, eye problems, unique facial features, and irregularly shaped vertebrae resembling butterflies. Additionally, the condition can also influence the kidneys and blood vessels. At its core, Alagille syndrome is characterized by disruptions in the NOTCH signaling pathway, which plays a vital role in embryonic development. This disruption is typically due to mutations in one of two NOTCH genes, JAG1, which is implicated in approximately 94.3% of cases, and NOTCH2, which accounts for about 2.5% of cases. To confirm a diagnosis of Alagille syndrome, the presence of a disease-causing mutation in one of these genes, along with at least one characteristic symptom, may be sufficient. In the absence of genetic testing, a patient usually needs to exhibit at least 3 signs or symptoms to receive a diagnosis. Determining whether a specific mutation in the JAG1 or NOTCH2 gene directly causes Alagille syndrome can be challenging. Classifying these mutations as likely disease-causing, benign, or as variants of uncertain significance, VOS, could provide valuable insights into the underlying mechanisms of the disease. The international research team aimed to enhance the classification of NOTCH2 variants and to explore the phenotypic differences between diseases related to NOTCH2 and JAG1. They analyzed data from 952 individuals with Alagille syndrome, who were recruited from 66 medical institutions across 29 countries as part of the Global Alagille Alliance GALA study, which is the largest natural history study of Alagille syndrome to date. Participants without complete genetic testing data were excluded from the GALA database. As anticipated, the majority of participants, 94.7%, had mutations in the JAG1 gene, while 3.6% had mutations in NOTCH2. Notably, mutations in either gene were undetectable in 1.7% of the participants. With 34 patients carrying NOTCH2 mutations, the researchers noted that this study represents the largest group of NOTCH2 patients documented in relation to Alagille syndrome. The results indicated that the rates of liver, kidney, and blood vessel involvement were similar between the JAG1 and NOTCH2 groups. However, several significant differences emerged in other disease characteristics. For instance, characteristic facial features were observed in 90.1% of participants with JAG1 mutations, compared to only 57.6% of those with NOTCH2 mutations. Additionally, a significantly higher percentage of individuals with JAG1 mutations had heart anomalies, 92.2% versus 64.3%, and butterfly vertebrae, 44.5% versus 3.3%. Another notable finding was the prevalence of posterior embryotoxin, an eye abnormality commonly associated with Alagille syndrome, which was reported more frequently in the JAG1 mutation group, 52.8% versus 18.5%. Researchers concluded that these phenotypic differences should be taken into account during clinical evaluations for Alagille syndrome. Interestingly, the overall survival rates and the likelihood of requiring a liver transplant did not show significant differences between the two groups. A valuable resource for medical professionals. Among the participants with NOTCH2 mutations, the researchers identified 30 unique genetic variants, 18 of which had not been previously documented in scientific literature. This discovery increased the number of reported Alagille-related NOTCH2 variants by approximately 30%. Using a set of validated criteria and disease-specific modifications, the team classified each NOTCH2 variant based on its potential to cause Alagille syndrome. A majority of these mutations, 60%, were classified as likely disease-causing or disease-causing, while the remaining 40% were categorized as VOS. The most frequently observed variants included the disease-causing C6007CT and the likely disease-causing C5858GA, 5.9%. When examining 61 NOTCH2 variants reported in patients outside the GALA study, the researchers reclassified 31.1% of them from likely disease-causing to VOUS, while one mutation was reclassified from VOUS to likely disease-causing. Approximately one-third of the variants retained their original classification. By compiling these mutation classifications, the researchers created a comprehensive database of NOTCH2-related genetic profiles in Alagille syndrome. They noted, this catalog serves as an invaluable resource for clinicians and clinical laboratory geneticists, facilitating the interpretation and classification of NOTCH2 variants. Interestingly, the study did not find a correlation between the type of mutation and the phenotype among patients with either JAG1 or NOTCH2 mutations, which aligns with findings from previous studies. Given the observed differences in disease features between the JAG1 and NOTCH2 groups, the researchers suggested that clinicians might consider genetic testing even in the absence of certain typical characteristics. However, the study did have its limitations, as it focused on individuals who exhibited at least some characteristic features of Alagille syndrome. The researchers concluded that further investigation is needed to determine whether non-characteristic features of Alagille syndrome can also be present in individuals with NOTCH2 mutations. What are your thoughts on the implications of these findings? Do you believe that expanding genetic testing could lead to more accurate diagnoses for those with Alagille syndrome? Share your opinions in the comments below.